Did you know that 6 out of every 10 men, which is 60%, and 5 out of every 10 women, which is 50%, report at least one traumatic event in their lifetime? Also, women are more likely to experience sexual assault or childhood sexual abuse. You may be asking yourself why I am doing a video in regards to trauma, and the sole purpose is to let you know that you are not alone when dealing with this. Also, I do this because majority of people who go through trauma think that they are the ones who caused it on themselves. Many times, trauma victims feel as though they caused it solely due to their own actions. However, that is the farthest from the truth. You are only the victim. Now let's get to the good news and what this video will be discussing today. We'll be discussing the 3 stages on how to cope with trauma and how you can change the neuroplasticity of your brain and cope with trauma long term and find positive outlets and how you can adapt and deal with trauma long term, resulting in living a healthy, loving life. Now let's talk about the 3 stages or phases of trauma recovery. But before I do that, please like and subscribe to the channel and leave a comment. And you don't have to go into details on if you've been through trauma or whatnot, but I always appreciate the comments. First, let's just give a general definition of what trauma is. What exactly is trauma? Trauma is an emotional response to a terrible event like an accident, rape, or natural disaster. Sexual assault. Trauma can come in many different forms. PTSD overlaps with it. It's a very generic term, but it affects, as I said earlier, so many people. 6 out of 10 men, 5 out of 10 women. Women, once again, are more likely to have been through a sexual assault or through childhood sexual abuse. So just wanted to start with that. Now let's talk about the first phase or stage of trauma recovery. So the whole point, and this is all about, this is supposed to be a good video and a good summary of what trauma, of how you can essentially recover from trauma. And the first phase or stage is primarily revolves around safety and stabilization. So typically people affected by trauma tend to feel unsafe in their bodies and in their relationships with others. One key is regaining a sense of safety, which may take days to weeks. With sometimes what I've seen with acutely traumatized individuals, it can take months to years with individuals who have experienced ongoing chronic abuse. So when you're going through these phases or stages that I'll be talking about, you can go into phase 1 to phase 2 and then have to go back, and it can be a chronic long cycle that continues. But if you practice these and you really work at it, this is what will help the neuroplasticity of your brain and change those pathways to help you cope with it long term. So, figuring out what areas of life need to be stabilized and how that will be accomplished will be helpful in moving toward recovery, which is huge. For example, a person who has experienced trauma may struggle with regulating or soothing difficult emotions in everyday life, which they might not associate directly to the trauma. Also, learning how to regulate and manage these difficult, overwhelming emotions is a huge one as well. Which I'm going to say that again, learning how to regulate and manage these difficult, overwhelming emotions. And these are notes I've taken down and that I've analyzed that I'm telling you about, that I can apply to what I've seen in the clinical setting as a psychiatric RN and what I think would be the most useful to discuss. So another critical point. Some people who experience trauma, particularly complex trauma, which is chronic trauma repeated, may find that speaking about their experiences are emotionally overwhelming, which can happen a lot in the groups they have at the place I work. A lot of times patients will come out crying, and just have an immense amount of emotions. So, recently, both therapists and researchers have been exploring nonverbal ways to foster emotional regulation. Interestingly enough, there have been several studies that have suggested that mindfulness-based stress reduction, which is MBSR groups, and the use of acupuncture for clients with PTSD reduces negative emotions and promotes a more calm appraisal of life situations, which would make sense, in my opinion. I can totally see that. And once again, we don't completely know how to go about this, because it's a case-by-case basis. Also, there are other types of self-soothing practices such as meditation, deep breathing, yoga, spiritual and cultural practices, depending on, race and ethnicity. It will vary between cultures on what people use and what works for others. But what I've just mentioned, there has been a lot of effectiveness in ways that this has been known to soothe the nervous system, or the central nervous system. So, the big thing I want to end with phase 1. Once again, the whole key to this phase is, as I stated earlier, is safety and stabilization. Summary: people affected by trauma tend to feel unsafe in their bodies and in their relationships with others. The key is regaining a sense of safety may take days to weeks with acutely traumatized individuals, or months to years with individuals who have experienced ongoing chronic abuse. And once again, figuring out what areas of life need to be stabilized and how that will be accomplished will be helpful when moving forward into the next stage of recovery. And let me end the phase 1 or stage 1 with this metaphor for creating safety, which is really good. It's by Rothschild. The experience, I'm going to end with this metaphor. The experience of emotional overwhelm is similar to that of a shaken bottle of soda. Inside the bottle is a tremendous amount of pressure. The safest way to release the pressure is to open and close the cap in a slow, cautious, and intentional manner, so as it is to prevent an explosion, which I just think is great. Now let's go ahead and go into phase 2. And remember, with these phases, you could go from phase 1 to phase 2 and go back to phase 1 depending on the scenarios with it. So now let's go ahead and jump into phase 2 of this. Now, once again, before you can move into phase 2, you must establish safety and stabilization. Now, in phase 2 or stage 2, I want to just give this out. I want to give this fact. Trauma recovery is best to be looked upon as a process that is worked on over time and in intentional stages. The reestablishing of safety is the first and most central step in recovery, separate and apart from whether the details of the trauma are ever spoken or not ever spoken. So safety is the biggest aspect to coping with trauma and moving forward through these stages or phases. So if you make it to phase 3 and your safety is affected, you move back down because you have to continue to establish safety. So phase 2 is remembrance and mourning. So let's start with this. The task shifts to processing the trauma, putting words and emotions to it, and making meaning of it. So this is stage 2 or phase 2 is remembrance and mourning. Now you might be asking, remembrance and mourning, this sounds like somebody has passed away. No, this is for trauma in general. So this process is usually undertaken with a counselor or therapist in group or individual therapy, which is true. Where I work as well, they do group therapy. There's not individual therapy, but outside of inpatient at a psychiatric hospital, you can get individual therapy. It might not be necessary or required to spend a lot of time in this phase, though. It is, however, necessary to be continuing to attend to safety, once again, safety and stability during this phase, which that's what I'll continue to reiterate over and over, which you'll get annoyed with, is you have to continue to establish safety and stability. Attending to safety allows the persona affected by trauma to move through this phase in a way that integrates the story of their trauma rather than reacts to it in a fight or flight or freeze response. So let me say that again. Attending to safety allows the persona affected by the trauma to move through this phase in a way that integrates the story of their trauma rather than reacts to it in a fight, flight, or freeze response. So pacing and timing are crucial during this phase. If the person affected by trauma becomes quickly overwhelmed and emotionally flooded when talking about their trauma memories, safety and stability must be regained before moving forward with the story. The point is not to relive the trauma, nor is it to tell the story, but more so to tell the story with no emotions attached. So this phase involves the important task of exploring and mourning the losses associated with the trauma and providing space to grieve and express their emotions. So this phase or stage can be very hard to get through with remembrance and mourning. And this is why this stage, for a lot of people, it can take, once again, weeks, months, years to get through, because this is the phase where you don't want them to relive the trauma, but you also want to expose them in a way to be able to tell the story with no emotions attached that will disrupt their safety. And understand that there still will be emotions attached to it, but if they feel unsafe and it's causing them to hurt them, and they're pacing, they're panicking, they're in their fight or flight, their safety needs to be reestablished, and that can be very tricky with this stage. So moving into phase 3, as stated again before I move in, you have to continue to integrate safety. So now let's jump in to phase 3 or stage 3 of trauma recovery. Now let's discuss phase 3. And before I go any further, please like and subscribe to the channel. And one other thing I wanted to cover. In phase 2, as stated prior, which is remembrance and mourning, there is vigorous debate in the field of traumatic stress as whether revisiting traumatic memories is necessary for healing or whether it may in fact be more harmful. I didn't say that in phase 2. Obviously, this is an individual matter, which I agree with, depending on the situation, how long it happened, what the stipulations were, you name it. Many may find it to be beneficial to tell and retell their experience of trauma, where others may find that as being more destructive to their well-being. So I just wanted to clear that up as well. So let's go ahead and jump into phase 3. And as I said before, if they can't establish safety, or you cannot establish safety when going through these coping with the trauma, you have to go back and establish safety. Safety is always the priority in mental health in general, whether you're a healthcare professional or you are a patient. So if you're feeling frustrated going through trauma and you're having to go back to the first phase, it's because we care about the safety aspect of it. And it's hard for anyone having to go back and having to continue to start the process over, although I don't consider the process being over. It's a continuous cycle in phases you're going through. So phase 3 is reconnection and integration. So to sum up this stage or phases, in this phase there must now be a creation of a new sense of self and the potential to see yourself in a new future. This final task involves redefining oneself in the context of meaningful relationships. Through this process, the trauma no longer is, and here's the key, defining and organizing principles in someone's life. The trauma becomes integrated into their story, but it is not the only story that defines them. So that's the key with this: reconnection and integration. It's being able to integrate your story of trauma, which is going, once again, the neuroplasticity in the brain, which we all can do if we're willing to put in the work, even though it can be really rough and the trauma can be tough. The key is once again, being able to integrate this once you've mastered it. And I don't even want to say mastered, but you've got a grasp on it, is being able to integrate this into your life, but it is not what defines you, and you always feel safe as well. In the third stage of recovery, the person affected by trauma recognizes the impact of victimization, but are now ready to take concrete steps toward empowerment and self-determined living. In some instances, though, people who have experienced trauma find a mission through which they can continue to heal and grow, such as talking to the youth, peer mentoring as well. Also, successful resolution of the effects of trauma is a powerful testament to the resiliency of the human spirit. So in this stage, the great thing is if you're able, once you get to this stage, long term, being able to tell people about your trauma if you feel comfortable with it, and then showing others that you can get through it. You can get through it. You do not have to be defined by your trauma that you've been through. Now, once again, recovery is an individual process, and it will look different for everyone. There is an intense desire to feel well quickly, and individuals can feel that the process is taking too long or they are not doing it right. Recovery is not defined by complete absence of thoughts or feelings about the traumatic experience, but being able to live with it in a way that isn't going to control your life, in a way you can cope with it and move on with your life in a way of not forgetting it, acknowledging the trauma, but not letting it take over your life. Not letting it take over your life. It is important to gentle, it is important to gentle, patient, and compassion with yourself as you move through the healing process. And once again, this process is a continuation a lot of times. And this is why I just discussed this, is the individual process of recovery from trauma is different for everyone. There can be an intense desire to feel well quickly, and individuals can feel that the process is taking too long or that they are not doing it right. Recovery is not defined by complete absence of thoughts or feelings about the traumatic experience, but being able to live with it in a way that it does not control your life. I repeated that again because that is the most important part of this, is that everyone's traumatic experience they go through is different. Going through these stages or phases is different. But in summary, the key is, it doesn't matter what age you're wanting, it doesn't matter what age you're trying to go through the recovery of trauma. But the fact that you are watching this video, or because you're trying to seek help, that's the first step as well in wanting to move on with your trauma. In my opinion, it's kind of like drug addiction in regards to everyone around you can want you to get help, right? But if you're not the one who wants to get the help, you'll go through rehab many times and you'll continue to relapse until you want this. So the fact that if you're wanting to get help and you're wanting to recover through the trauma, that is the first step. But remember, it is very complex. However, your brain, the best thing I feel like as humans that we have is we have a body, a brain that is neuroplastic. The pathways can readjust. If you've been through childhood trauma, adulthood trauma, it doesn't matter. That's why I believe so heavily in regards to protecting children, being very cautious and asking them questions if you feel like they're going through trauma, or if you yourself are going through trauma. But I just want you to know there is help, there is recovery, and you can do this. I love you all. This is your daily dose of mental health with Adam. I'm going to continue to put out videos every week. I love you all. Please like and subscribe to the channel. I greatly appreciate it. I like doing these ones where I just where I don't even have a board or anything and just talk, because sometimes these ones are the best videos, not even just for you, but for me. This channel solely, I'm wanting to help others, but also this helps me stay sober in my own ways too. I love you all. Have a great week.